Early warning signs of heart disease. Do not ignore. Did you know that every year, millions of people around the world unexpectedly develop heart disease without recognizing the early warning signs? Heart problems are not just a concern for the elderly. Even young people are at risk if they don't take proper care. Unfortunately, many early symptoms are very subtle and often mistaken for general fatigue. But if you can recognize them early, you can completely prevent serious consequences. In today's video, let's explore 7 early warning signs of heart disease that you should never ignore. Chest pain or a feeling of pressure on the chest. This is the most common symptom of heart disease, especially in cases of myocardial ischemia or angina. The sensation may feel like a dull ache, burning, or as if something heavy is pressing on your chest. Sometimes the pain spreads to the left arm, shoulder, neck, or jaw. However, it's not always intense. It can simply be a mild but recurring discomfort. If you feel this way, see a doctor immediately to rule out any heart problems. Shortness of breath, especially when resting or lying down. Shortness of breath is one of the earliest and most overlooked signs. You might feel breathless while climbing stairs, talking for a long time, or even when lying down. In many cases, this is due to the heart pumping inefficiently, causing fluid buildup in the lungs and making it hard to breathe. If you don't have lung issues but frequently experience shortness of breath, it could mean your heart is struggling. Excessive sweating, even without physical activity. Cold sweats or clammy hands, even when you're sitting still or doing nothing strenuous, can be a sign that your body is reacting to a lack of oxygen due to poor heart function. This symptom often comes with fatigue, dizziness, or nausea. It may indicate an impending heart attack and should not be ignored. Swelling in the legs, ankles, or abdomen. If your legs or ankles swell, especially by the end of the day, or if pressing on the skin leaves an indentation, it may be a sign of fluid retention. This occurs when the heart isn't pumping blood effectively, causing fluid to accumulate in the lower limbs or abdomen. This symptom is often accompanied by a heavy or uncomfortable feeling and can signal heart failure. Irregular heartbeat or unusual changes in heart rate. Feeling like your heart is racing, skipping beats, or beating irregularly is not always harmless. Heart rhythm disorders can increase the risk of stroke or heart failure if left untreated. If your heartbeat feels unusual even at rest, or if it comes with dizziness, see a doctor to get an electrocardiogram. Persistent fatigue and decreased stamina. If you find yourself getting tired quickly while doing simple tasks like walking, cooking, or even just after waking up, it could mean your heart is working too hard. A weak heart cannot supply enough blood and oxygen to the rest of the body, leaving you tired for no clear reason. Dizziness, lightheadedness, or brief loss of consciousness. Feeling dizzy, off balance, or even fainting could be the result of insufficient blood flow to the brain. This is a serious warning sign and can happen suddenly, posing a danger if you're driving or doing physical activities. Frequent fainting episodes are a strong reason to get your heart checked immediately. If you notice 2 or more of these symptoms, especially if you have a family history of heart disease or risk factors like high blood pressure, diabetes, obesity, or smoking, consult a doctor as soon as possible. Heart health is the foundation of a long and quality life, so never take it lightly.